everyone, welcome again to my YouTube channel. Today I'm gonna explain you about one of the most important topic from pharmacology. This important topic is pharmacokinetic, which is a component of general pharmacology. If you don't know about general pharmacology, please go and watch my first video, which is about introductions to pharmacology. Today I will try my best to make this topic by simplified and master concept with the clinical correlation. If you are ready, let's go to start the lesson. So as I told you, today I'm going to discuss about pharmacokinetics. This word derived from Greek word pharmaco, drug, and kinetics, movement, the movements of the drug. I think you have already familiar about this word from physics, but in pharmacology we have a common definitions for pharmacokinetics. This common definition is what the body does to the drug. It can be the common definition for pharmacokinetic. So now I think most of you are confusing about this definition, but don't worry, now I will try my best to explain this definition by easier way. So imagine this is a patient, so I'm a doctor. This patient comes to me with any complaint. So I am as a doctor, I will prescribe a drug for this patient in order to eliminate his complaint. So this is a drug. So when this patient takes this drug, what happens with this drug in his body, all that process is called pharmacokinetics. There are totally 4 main stages of pharmacokinetic: absorption, distribution, metabolism, and excretion. It means the patient's body, they first absorb the drug, then distribute drug, after that metabolize, at the end they will excrete the drug from his body. All that process include to the pharmacokinetic. Now there are 4 stages as I told you. First of all, I am gonna to explain all 4 stages in this picture by the general concept. Then we will go detail about each stages one by one. Let's get started from absorption, which is the first stages of pharmacokinetic. So absorption is the movements of the drug from the sites of administration to the blood circulation. So here I will write movements of the drug from site of administration, to the where? To the blood circulation, So this process is called absorption. But here listen, from sites of administration to the blood circulation. Now in order to know detail about the absorptions, you have first of all know about administrations of the drug. Why? Because before the absorption there is administrations of the drug. Here there is administration drug. There are many routes of administration drugs, but all of them classified in 2 groups: enteral and parenteral types of the administrations of the drug, which is the precedings of the absorption. So now it is at the enteral, where the drug takes through the GIT, through the gastrointestinal tract, which start from the mouth and end with the anal parts of the rectum. This is called the enteral types of the administration. The second one is the parenteral types of the administration, where the drug taken outside of the GIT, outside of the gastrointestinal tract. This is called the parenteral types of the administration. Now I'm gonna to explain you which types of the administration include to the enteral type and which one to the parenteral. So let's start. So the first one, it is enteral types of the administration. The first, which is the most common, it is oral types of the administration. Oral types of the administration, which is known also peros, where the drug takes through the mouth. The patient put the drug on the tops of the tongues, then from the tongues they will swallow it to the way to the pharynx. From the pharynx it goes to the way to the esophagus, then ultimately they will reach to the stomach and intestine. It is the first routes of the enteral types of the administration. So the second types of the enteral administration, it can be sublingual administration. So sublingual, it means under, and lingual means the tongue. So the drug put it under the tongue, from there by the local circulation the drug will be absorbed. It can be sublingual types of the administration. For example, nitroglycerin, it is the types of the drug put it under the tongue, from there they will be absorbed by the local circulation. It was the second. Now let's go to the third types of the enteral administration. The third type, it is buccal types of the administration. Buccal types of the administration. So buccal types of the administrations. Buccal means cheeks. So the drug put it between the gums and inner cheeks. From there, like the sublingual types of the administration, the drug absorbed to the local circulation. It was the third types of the enteral administration. So now the last ones, the last types of the enteral routes of administration, it can be rectal types of administration. Rectal types of administration. Rectal types of administration, where the drug takes through the rectum. It was all the routes of the enteral types of the administrations. So now you have to know which dose of the drug takes through these enteral types of the administration. Especially the drug which are in the solid dosage form. Dosage form. Which drugs are in the solid dosage form? Tablets, it means pills, drage, granules, capsules, and suppositories. Especially for the suppositories, for the rectal types of the administration. And tablets, capsules, drage, granules, all of them can be taken through the oral, sublingual, sometimes through the buccal types of the administration. It was about the enteral types of the administration. Now let's discuss about the parenteral types of the administration. There are many ways where the drug administrated except the GIT. So here include, for example, drug can be taken through the several way. For example, the drug can take us through the skin. Through the skin, there are several methods. For example, above the skin, we can give the drug above the skin. How we can administrate the drug above the skin? For example, there is ointment which is for the treatments of the scar or ulcerations of the skin. We can use it topically above the skin. It was the first way where we administrate the drug through the skin. The second one, it can be intradermal. Intradermal, the drug can be through the injections administered in the dermis layers of the skin, which is located below the epidermis. Dermis, intradermal. So intradermal. So which types of the administration? For example, there is some test, especially tuberculin or Mantoux test, which can be used for the determining of the Mycobacterium tuberculosis. Or there is some test to determining of the antibiotic sensitivity test. All that types of the test can be administered through the intradermal types of the administration. It was the second types of the administration which take us through the skin. So let's go to the last one, subcutaneous. Subcutaneous, it is also types of the administration where the drug injected in the hypodermis, the layers which is located between the dermis and between the muscle. So for example, some drugs, insulin or heparin, can take us through the subcutaneous injection. It was the parenteral types of the administration where the drug takes us through the skin. So now let's go to the second one. Except the skin, also the drug can be taken through circulatory system. Through the circulatory system, it can be intravenous, and intraarterial. This is the most common routes of the administration, which is the best choice during the emergency situations. Why? Because they have the high bioavailability. Later I will explain in the absorptions. It was the second routes of the parenteral administration. The drug takes through the circulatory system, intravenous and intraarterial. So the third one, the drug can be taken also through the locomotion system. The drug can take us through locomotion system. So drug takes us through the locomotion systems. How can we take the drugs through the locomotion system? For example, intramuscular injections. We will inject the drugs in the large muscles of the body. In the gluteus muscle or deltoid muscle, we can inject the drug. So except the intramuscular, also we have intraosseous. There is a drug which we administered in the medullary cavity of the bone. So also in the locomotion systems, through the locomotion systems, we can inject intraarticular. There is a intra-articular, it means there is administration of the drug in the joint's cavity. All are the types of the administration which take us through the locomotion system. So let's go to talk about the first types of the parenteral administrations. So the first one, it means the drug can take us through the membrane of brain and spinal cord. So which types of the administration can be take us through the membranes of the brain and spinal cord? It is the subarachnoid and subdural administration. So these types of the administration can be used mainly in the regional or conductive types of the anesthesia, especially subarachnoid in the spinal anesthesia. We can inject the anesthesia through subarachnoid membranes of the spinal cord. It was the first types of the parenteral routes of the administration. So now let's talk about the fifth, and which is the last one also, the last routes of the administrations of the parenteral types of the drug. The drug can be taken through the drops, through the drops in ear, drops in eye, also can be drops where through in nose. So there is some of the drugs, there is the administration of the drug which takes through the drop in ear, drop in eye and nose. In some literature you can find these routes of the administration can be included to the local types of the administrations. So it was all types of the administration of parenteral types of the administrations of the drug. Now you got this is enteral and this one is the parenteral types of the administration. Except this enteral and parenteral types of administration, there is also inhalation or respiratory types of the administration where the drug can be administered through the inhalations. Now, but the most common one is the enteral and parenteral. Both of them, they have the positive side and negative side. It means they have the advantage and disadvantage. Now, first of all, we will discuss about the advantage of the enteral types of administrations, then about disadvantages. So, advantage, it means the positive sides for the enteral types of the administration. What is the positive sides for the enteral types of the administration? So, as I told you, the drugs which take us through the enteral types of the administration, they are in the form of the solid dosage form. If they are in the solid dosage form like tablets, it means pills, drage or capsules, they are what easy to use. All of those drugs, they are easy to use. It means they don't require any medical personality. They not require any sterility. They are the positive side for these enteral types of the administration. They don't require sterility. Also, then don't require medical personality. This is the positive or advantage of the enteral types of the administration. It was the first one. Now let's go to talk about the disadvantage of the enteral types of the administration. So the disadvantage for the enteral types of the administration is the first. It is they have the slow action. They have the slow action. We cannot advise or we cannot prescribe advise these groups of the drug in emergency situation or in emergency case because they have the slow actions. It was the first negative or the first disadvantage of the enteral types of the administration. The first. Also, there is some of the drugs which cannot take us through the GIT, through the enteral types of the administration. Why? Because as we know, in the GIT there is acidic medium, there is acidic nature. Some of the drug has the resistance in hydrochloric acids of the stomach. For example, penicillin G, which is in types of the natural types of the penicillin, or insulin, they cannot take us through the GIT. They can be ineffective due to the hydrochloric acid. It means it can be decrease the effects of the drug, effect of drug due to hydrochloric acid. It was the second disadvantage for the what, for the enteral types of the administration. So the last one also it has the negative sides of the enteral types of the administration. During the vomiting there decrease also the drug, the effects of the drug. Why? Because during the vomiting the gastric content will go out through the mouth. If the gastric content go out through the mouth, the drug also is well placed in the gastric content. This drug can be also go out with the gastric content. It means during the vomiting the drug effect decreased during the vomiting. So it was the advantage and disadvantage of the enteral types of the administrations. Once again I will repeat, the enteral types of the administration, the advantage is easy to use. Why? Because they are pills, they are drugs, they are capsules, they are granules. They don't require sterility, they don't require medical personnel. It was the advantage. Disadvantage, they are slow, they have slow action. We cannot prescribe it for emergency case, they cannot helpful. The second one, the drugs, there is some of the drug which cannot take us through the GIT. Why? Because due to the hydrochloric acid. For example, penicillin G or insulin. Also the drugs during the enteral types of the administration, the effects of the drug decrease during the vomiting when the gastric content come out through the mouth. It was the advantage and disadvantage of the enteral administration. Let's talk about the advantage and disadvantage of the parenteral types of the administration. So first of all, the advantage of the parenteral types of the administration, they have immediate action. They have immediate action. They have immediate action. They have the first advantage, which is the best choice in emergency situation. The second one, the second advantage of the parenteral types of the administration, they are useful for the drugs which cannot take us through the enteral types of the administration. Which drug cannot take us through the enteral types of the administration? Now I brought you example here which has the resistance for hydrochloric acid, it was for example penicillin G and insulin. So in parenteral administration it can be useful for those drugs. It means useful for drug which can't give in GIT or enteral types of the administration. It was the positive or advantage sides of the parenteral types of the administration. Now let's talk about disadvantage of the parenteral types of the administration. Disadvantage of the parenteral types of the administration is the first, it is what? Pain. Why? Because through the injection we will administrate the pain. The first one. The second one, infection. Infection. We will open the gate for infection. The third, required medical personality. So these enteral types of the administration don't require medical personality, but the parenteral types of the administration, they require the medical personality. Also the fourth one, it required the parenteral types of the administration required what? Sterility. Sterility. It was the disadvantage of the parenteral types of the administration, which is invasive process. It was about enteral and parenteral types of the administration. Now I will choose you one roles of the administration, then we will go detail till the excretion stages of the pharmacokinetic. So I will choose oral types of the administration. Why oral types of the administration? Because as we know, approximately 70% of the drug, 70% of the drug is in the forms of the solid dosage form, in the forms of the pills, drugs, capsules and granules. That's why I will choose the oral types of the administrations. Then I will explain you by the general concept all these stages. So after now, as I told you, administration is the precedings of the absorption. After the administration there is absorption. Let's go to the absorption. So This is the patient. I will explain you by the real pictures of patients. So this is a patient. So this patient comes, doctor, I have a pain. Where? For example, this patient has pain in back sides of head. He has a migraine in back sides of head. So I am, as a doctor, I am responsibility first identify the causes of this pain in back sides of the head, then diagnose it. After that, I will prescribe to him a drug in order to eliminate his pain. So this is a drug. So as I told you, I will explain you by the oral types of the administration. So this drug, this patient take the drug through the mouth by the oral types of the administration. It takes through the mouth with the tongue. It swallows it. It comes to the pharynx. From the pharynx, they come where? To the esophagus. From the esophagus, the drugs consequently reach where? To the stomach. Here we have the drug. So here we have the drug. This is the drug which reaches to the stomach. So now this drug is large. It is large particles. It cannot directly absorb to the blood circulation. They must be in the liquid form. That's why under the actions of the muscles of the stomach, they will break down to the small particle. They will break down to the small particle. So they will break down to the small particles. This process which large particles break down to the small particles, it is called disintegration. Here I will write for you disintegration. So this process, as I told you, occurs under the actions of the contractions of the muscles of the stomach. So now we have the small particles. So here we have the gastric content. These small particles, they will dissolve where? In the gastric content. Here we have the drug in the liquid form. Here we have the drug in the liquid form. So this process is called what? Dissolution. It means the dissolutions of the small particle to the gastric content. The first disintegration, the second one dissolution. So the second stage is dissolution. Now we have the drug here in the stomach. Some of the drug absorbed from the stomach, from the acidic medium. Some of the drug absorbed from where? From the intestine, from basic medium. Why? What is the reason behind of it? Later I will explain you in absorption when we go detail. Now only you know that the drug which is acidic, they will absorb from the acidic medium. If the drug is the basic, they will absorbed from the basic medium. So here we have the drug. Now we have the drug through the several mechanisms. They will absorb to the blood circulation. Here this is the blood circulation. Here we have the drug from the stomach. Here absorbed from the intestine here. So what is the name of this blood circulation? The name of this blood circulation is the portal circulations. Most of you, I think you have already known about the portal circulation, but once again I will remind you, portal circulation is the collections of the vein from unpaired organs of the abdomen. For example, this is unpaired of organs of the abdomen, stomach, from the gastric vein, or intestine, through the suppositories vein, or through the splenic vein. All these organs, this portal system collect the veins through the unpaired organs of the abdomen. So now we have the gastric vein which collects the blood from the stomach. Here we have superior mesenteric vein which collect the blood from the small intestine. Now the drug, when the drug from here, from the sites of the administration, from the intestine or from the stomach, they will absorb or they will pass to the blood circulation. This process is called absorption, which was the first stages of the pharmacokinetic. That's why I told you absorption is the movements of the drug from sites of the administration to the blood circulation. It was the absorption. This process from here till the here, or from here till the here, it is called the absorption. It was the first stages of pharmacokinetic. All of you, if you got, please, at the end of, if you got this concept, please then respond to me by the sharing of this video or commenting. So now it was the first stage of absorption, the movements of the drug from sites of the administration to the blood circulation here. Now when the drug absorbed, where it must go? It must go to the sites of the action. Where it was the sites of the action? Here. The patient had migraine in back sides of the head. The drug must go from here till the here. This process is called distribution. It means distribution. So it means the movements or deliverings of the drug, from sites of the absorption. Here, this is the sites of the absorption. This is the sites of the absorption. Here, the drug which move from the sites of administration to the portal circulation. But distribution is the delivery of the drug from here till the here. It was the sites of the action. The reverse of the drug from site of absorption, from sites of the absorption to the where? To the site of the action. Site of action. Where is the site of the action? Here in the back sides of the head. Because my patients had migraine in back sides of the head, the drugs must go here. How the drug find its where is the migraine, where is the headache? It is dependent on the receptor and violation parts of the body. So now the drugs, how it goes, now I will explain you. The drugs through the portal system, where it goes, the drugs comes to the liver. For here we have the drugs which comes to the liver. When it comes to the liver, it undergoes the first pass metabolism. Later I will tell you about the first pass metabolism. Slightly change occurs in the drugs. Then after that the drug through the, here we have the hepatic vein and vena cava inferior. Vena cava inferior. Here we have, now I will draw you. So imagine how, now I will explain you in detail how the drug, for example, if this patient has headache, how the drug reach here. So the drugs from the portal circulation, when absorbed from the portal circulation, it comes to the liver, it undergoes to the first pass metabolism, then it goes where? To the hepatic vein. So this is the hepatic vein. This is the hepatic vein. So this is the hepatic vein. So this is hepatic vein. So the drugs from the liver, it goes to the where? To the hepatic vein. Then through the hepatic vein, it comes to the where? Vena cava inferior. So vena cava inferior. So the drugs from the hepatic vein, it comes to the vena cava inferior. This is the veins which drain where? To the right atrium. This is the vena cava inferior. Then when the drugs from here, through the vena cava inferior, it comes to the where? To the right atriums. From the right atriums, it comes to the right ventricles. Through the right ventricles, by the pulmonary artery, it goes to the pulmonary circulation. Then through the pulmonary circulation, the drug comes to the where? Through the pulmonary veins, it comes to the right atriums, left atriums. Then through the left atriums to the left ventricle. As a result, consequently, the drug reaches to the where? To the aorta. So this is the aorta. This is the arcus of the aorta. Now we have the drug here. In the arcus of the aorta, there is several branches. As we know, it has three main branches. Three main branches. The first, it is brachycephalic trunk. Then we have the left common carotid artery and the left subclavian artery. So this is the brachycephalic trunk. We have the brachycephalic trunk which bifurcate in two branches, right subclavian and right common carotid artery. Now the drugs through this through the arcs of aorta, by this vein, by the common carotid artery, or through the vertebral artery which origin or which arise from the through the subclavian vein. Through this vein, it comes where? To the sites of the action, where is the receptors for this drug. Here, for example, we have the receptors. So this drug, they will come and reach to the sites of the action, by which artery, as I told you already, by through the brachycephalic trunk, right and left common carotid artery, or through the vertebral artery which arises from the subclavian artery. Through all this artery, the drugs comes to the where? Occipital parts of the brain. So when it reaches to this point, this process is called the distributions, the deliveries of the drug from the sites of the absorptions to the where? To the sites of the actions. It was the second stages of the pharmacokinetic, which was distribution. So when it reaches, after that, how it eliminate the pain, it's not included to the pharmacokinetic. It can be another topic which is called pharmacodynamic. How it provides its action, how to eliminate its pain. All this process it's not included to the pharmacokinetic. It included to the pharmacodynamic. Only the delivering of the drug from the blood circulation to the sites of the action, it is called the distribution. So it was the second stages of the Pharmacokinetic. Now let's go to talk about the third stages of the pharmacokinetic, which is the metabolism. So metabolism, so this is the metabolism. So this is the metabolism. Metabolism also known as biotransformation. So how this occurs? So now the drugs, when it can reach from sites of the absorptions to the sites of the actions, after that it provides action. Pharmacodynamic occurs. So when it provided its actions, the patient's body doesn't need this drug. It must to excrete from his body. The patient's body must remove this drug. So it doesn't need this drug. So how it removed? The first, these drugs again, they will come through the venous sinus of the brain. They will come via to the vena cava inferior, then through the vena cava inferior right atrium, through the right atrium, right ventricle, again the pulmonary circulation. After that to the left atrium, then the left atrium, left ventricle, through the arcus aorta they will come. So the drug must excrete from the body, but here the kidney has one property. The nephrons of the kidney has one property. This kidney excretes those drugs which are polar drug, which are the hydrophilic drug, water soluble drug. So if the drug is water soluble or hydrophilic, they can be easily excreted, but most of the drug according to the nature, it can be hydrophilic. It can be not water soluble. They are not water soluble. It means they are non-polar types of the drug. If they are non-polar types of the drug, the kidney cannot excrete them. That's in order to the kidney excrete that non-polar drug must be converted to the polar. Where this process occurs, of course, in the liver. So when, as I told you, the drugs through all the sinus comes to the aorta. After that through the aorta, through the descending aorta, it comes where again this portal circulation through the hepatic artery. They will come and enter to the liver. Then through the liver, that non-polar drug converted to the polar drug. So non-polar drug converted to the polar drug. It means non-water soluble drug converted to the water soluble drug. Then this so this process, when this non-polar drug converted to the polar drug, this is called the metabolisms of the drug, which is the third stages of pharmacokinetic. So what was it means? What is the metabolism? Converting of non-polar drug to polar drug. That's why metabolism, also known as biotransformation, transformations of the one substance to the another substance. This process occurs where, especially in the liver. It was the third stages of pharmacokinetic, which is called metabolisms of the drug. So after the metabolism, which stage we have? Excretions. Now the drugs must excrete. Again, these drugs through the hepatic vein, vena cava inferior, to the right atrium, right ventricle, pulmonary circulation. After that to the systemic circulation. Through the systemic circulation, they come through the renal artery. Then through the renal artery, they go to the nephron. Then through the nephron tubulus, they will easily excrete. If this is which drug? Polar. Now that the drug is already polar, they can easily excrete through the kidney because they are water soluble substance. Now it was about excretion. Excretion is what? The removing of drug from body. So it was all about by the general concepts of the absorption, distribution, metabolism, and excretion stages of the pharmacokinetic. It was by the general concept. As I promised you, I am going by that process. First, I told you, explain you by the general concept all that process. Then we will go detail about each stages. Now we have finished about the general concept. Now let's go to talk detail about the absorptions. So once again, before to go about the absorption, once again I will review this general concept. The first, it was absorption. What was absorption? the movements of the drug from here till the here, from the sites of the administrations to the blood circulation. This process is called the absorption. The second one, it is the distribution. Distribution is what? The delivering or movements of the drug from the sites of the absorption to the sites of the action. This process is called what? Distribution. So the third one, that when the drug provides its action, it must excrete from patient's body. But most of the drug is non-polar. If they are non-polar, the kidney cannot excrete them. In order to kidney excrete, they must be in the polar forms. They must be water soluble. So that's why before to excretion, the drugs undergo to the where? To the metabolism. They come to the kidney, to the liver. In the livers, by some enzymes, they will convert non-polar drugs to convert to the polar drug. It means the non-water soluble convert to the water soluble drug. Then this water soluble drug again circulated. It comes to the renal arteries through the nephron tubules. They will excrete from the body easily. It was about the general concept. Now let's go to talk about absorption detail. So absorption, you know already about definitions of it, because we talked here about the absorption. Absorption, what is this? Movements of the drug from the sites of the administration to the blood circulation. Now there are many here it was the movements of the drug from the site of administration to the blood circulation. But here there are many mechanisms there are different mechanisms of the movings of the drug from sites of the administration to the blood circulation. Now I will explain you about each of them one by one. So for example, there is some of the drug, for example, when they comes to the stomach, or this is the drug, they will easily from the high concentration transfer to the low concentration. Here to low concentration, they will easily transfer from this is the stomach, this is the gastric vein or the portal system, and this is the gastric cell. This is the gastric cell. And the drugs, in order to reach to the blood circulation, they must pass through this gastric cell. If it is through the intestine, they must pass through cross through the enterocyte, which is the cells lining in the mucosal layers of the intestine. So now here, as I told you, there is the groups of the drug. When they comes through the high concentration, they will transfer to the low concentration. So what is the name? Without any energy, without any requiring of energy, without any requiring of the transport system. So what is the name of this? What is the name of this process which these mechanisms of the process of the absorption? This is the passive type. This is the passive types of the absorptions when the drug comes from the high concentration to the low concentration. So these are which groups of the drug? You have to know. These are the drugs. These are the small drugs. So these are the small drugs. These are the hydrophobic drug. So if they are small or hydrophobic drug, they will easily, without any transport system or without any energy requiring, they will transfer. Example, steroid drug. Dexamethasone or prednisolone, can be absorbed through this mechanism. Steroid or steroid drug. Also alcohol also through the passive absorption, they will reach to the blood circulation from the sites of the administration. It was the first mechanisms of the absorption. So the second one, there is also some drug. There is some drugs. Here we have the drug. So there is the drugs which pass through the high concentration to the low concentrations, not directly, by the help of the special transport system. So here we have the transport system. So there is some of the drugs which use this transport system in order to what? In order to transform this drug from sites of the administration to the blood circulation. So here the question arises, what is the name of this types of the administration? So the name of this administration, it is called facilitated types of the absorption. It was the passive, and this one it was the facilitated. Now we talked for the passive types of the absorptions. Which the drug include small drug, hydrophobic drug, or example steroid or alcohol. Now you have to know which drug absorbs through the facilitated types of the absorptions, facilitated types of the mechanism. These are the drugs. These are larger drug, or hydrophilic drug. So example, glucose. For example, glucose can be absorbed through this mechanism by the using of this special transport system, transport protein. So it was the second types of the mechanisms of the absorption. So the third type. There is some of the drugs when they reach to the stomach, and they will transfer from the low concentration to the high concentration. Vice versa to this facilitative or passive types of the absorption. It means they will go against to the gradients. So from the low concentration to the high concentrations. But in this process, the requires of source of energy, ATP. Here we need ATP. This is ATP. For example, this is the source of energy. So without the source of the energy, this drug cannot pass to the blood circulation. So under the actions of this energy or requiring of this energy, this drug can be passed from the sites of the administration to the way of blood circulation through this gastric cell. It was the third types of the mechanisms of the absorption, which is called the active types of the absorption. The first one was passive, the second one facilitative, the third one it is the active one. So which one is the active one? You have to know which groups of the drug. Also, this is the drugs which are large, large drug, or the drugs which are hydrophilic. The third one, example. It means the large drug or hydrophilic drugs can be absorbed through this mechanism. Which drug can be through the active types of the absorption has levodopa, the best drug which is used for the treatments of the Parkinsonism. It is anti-Parkinsonian drug. It was the third types of the mechanisms of the absorption, which is the active types of the absorption. So let's talk about the another types of the mechanisms of the absorption. So here we have again the drug in the stomach. Here we have again the drug in the stomach. Here we have again the drug in the stomach. So now this drug also from the low concentration, from high concentrations, it is according to the gradient, not against the gradient. High concentration to low concentration, but cannot directly. It can be absorbed through the membranes of this cell. Here, this is the membranes of the cell. These membranes of the cells engulf this drug. So when it engulf it, then transport this drug to the blood circulation. So this process, it is also a type of the absorptions which is called endocytosis. Now here I will write. Endocytosis, especially pinocytosis types of the endocytosis, where the membranes of the gastric cell engulf the drugs and transform it to the blood circulation. So this is which groups of the drug? These are the drugs. Again, these are the large drug, hydrophilic drug, and example of this drug, for example, vitamin B12. So vitamin B12 can be absorbed through this way, through the endocytosis. The membranes of the gastric cell first engulf it, then after that it to the blood circulation. It was the first types of the mechanisms of the absorption. Let's to talk about the first one, which is the last types of the mechanisms of the absorption. The last one here, we have again the drug. Here we have again the drug. Here again we have in the stomach drug. So now this drug, without requiring of energy, without any protein system, or without the membranes, here membranes of the gastric cell has the pores. Here it has the pores. Through these pores, the drug can be easily transferred to the blood circulation. They can be easily absorbed. So now what is the name of these types of the absorption? So these types of the mechanisms of the absorption, it is called filtration. Filtration. So filtration. Why filtration? Because the drugs can be passed through these pores of the gastric cells, which has it. The drugs pass through the gastric cells to the blood circulation. So these types of the mechanisms of the absorption, it is called filtrations. So it was the generally about the mechanisms of the absorption. There are totally in the common 5 main routes of the mechanisms of the absorption. The first is passive, the second one facilitative, active, endocytosis, and filtration. In the passive, the drugs from the high concentration to the low concentration, they can be passed without any energy requiring, without any transport protein. In the second one, facilitated types of the mechanisms of the absorption, where the drugs can pass through the gastric cells through the transport system, for example the glucose. The third one, active, it was which required the ATP, for example levodopa. The fourth one, the membranes of this gastric cell or enterocytes engulf these drugs, then transfer this drug to the blood circulation. And the last one, which I already explained to you, it was the filtration, where the drugs pass through this pores. It is called through this pores it reached the blood circulation, which is called the filtration. So I didn't mention about which groups of the drugs can be absorbed through the filtration. The drugs which are the small drug and water soluble drug. Example, urea and electrolyte. So it was in generally the basic mechanisms of the absorptions. Now let's go on about the which factor affect in each types of the mechanisms of the absorption. There are many factors which affect in the mechanisms of the absorptions, like the size of the drug, the formulations of the drug, the surface area of the absorptions. Also, the blood flows can be affected in the mechanisms of the absorption. Then the pH. Here I will not explain about each factors, but I will explain only about the pH, which is the most important factors and the most important factors which affect in the each mechanisms of the absorption. Now I will explain you how the pH affect in the drug absorption. So in order to know about, first of all, about the pH, here we have to know about the types of the drug according to the chemical nature. As we know, there are two main groups of the drug can be according to the chemical nature. If the students who are smart, they know these groups of the drug. The drugs can be non-electrolyte and electrolyte according to the chemical natures. Then the electrolyte can be subdivided into the strong electrolyte drug and to the weak electrolyte types of the drug. Here, now I'm explaining how the pH affecting in the absorptions of the drug. So now those drugs which are non-electrolyte, they are not dependent on the pH. Here I wrote it. These groups of the drug is not dependent on the pH. The second one. Also, as I told you, the electrolyte drug can be strong and weak. Those drugs which are strong electrolyte drug, they are also not dependent on the pH. only the drugs which are weak electrolyte drug, they are dependent on the pH. So the question arises here, why the pH is so important for the absorptions of the drug, if they only the weak electrolyte types of the drug dependent on the pH. The answer is that most of the drugs are, according to the chemical nature, they are weak electrolyte drug. That's why I told you the pH is the most important factor which affect in each mechanisms of the absorption. So now here, what is the pH? pH is a scale which measures the amounts of the concentrations of the hydrogen in solutions. If there is a high concentration of the hydrogen in the natural the pH is 7 in the naturally. So if the concentrations of the hydrogen increase in solutions, the numbers of the pH from the 7 will decrease. 6, 5, 4, 3. If from the 5 decreases, it is called what? Acidic. It can be acidic types of the pH. If from the 7 increase 8, 9, 10, like 11, it can be basic types of the pH. Once again, I will explain. pH is a scale which measures the concentrations of the hydrogen in solution. If there is high amounts of the hydrogen in solution, it can be acidic. If there is less amounts of the hydrogen in solution, it can be basic or alkaline. So for example, the acid include hydrochloric acid, sulfate acid, nitric acid. To the basic include the sodium hydroxide, potassium hydroxide, calcium hydroxide. Or these groups are called basic, and this compound are called what? Acidic. So it was about the chemical natures of the drug. So now we say the weak electrolyte drug dependent on the pH. So now imagine these are the drug. This is the acidic drug, and this one is what? Basic drug. So when the drugs before to absorb or before to metabolize, before to provide its action, they are in which form? In the hydrochloric. They are in the forms of the unionized form. But when they enter to the body, when they absorb, when they metabolize it, then they are dissociated in the body. Dissociated in the which form? In the cation and anion. Cation and anion, which together called anion form. Anion form. In the basic, it is the same process. When they enter to the body, they are in unionized form. But after the entering into the human body, they will dissociate it into the cation and anion, which together called ionized. So this parts of the acidic, in this parts of the compound, it is called unionized form. After the reaction or after the dissociation, it is called ionized forms of the drug. Now here we have the golden rules. You should to pay or to listen to me carefully. So this is the golden rule which is in human body for the absorption stages of the pharmacokinetic. What is this golden rule? The first golden rule, it is the body absorb unionized form. Always the human body absorbed only these drugs, unionized drug. Unionized drug. These parts of the drug always they will absorb. Here the body absorb an ionized drug, and body excrete ionized forms. It means the body excrete these groups and absorb an ionized form. Also this body absorb and excrete an ionized form. You should to memorize this rule because it is important. Now later you will understand why it is important. So body absorb an ionized form. Now I think you got, and body excrete ionized forms of the drug. So it was the first golden rule. The second golden rule, now you will come. So the second golden rule is the body absorb these unionized forms from same pH medium. From same pH medium. It is the rules of the body. What does it mean? What is the meaning of this? It means absorb the body absorb unionized drug from the same pH medium. If you remember in the beginning, I told you some of the drugs absorbed from the stomach to the blood circulation. Some of the drug absorbed from the intestine to the blood circulation. Now we came to this concept. So this is dependent. This is due to this rule. Absorbs it is the natures of the human body. It means always the human body absorb unionized forms of the drug from the same pH medium. If it is acidic drug, they absorb from the acidic pH medium. If it is the acidic, it means they absorb from the stomach. As we know, the stomach, it has the acidic medium. There is hydrochloric acid. It causes the acidity. It means the acidic drug absorb from the acidic pH medium. If it is the basic drug, they will absorb from the basic pH medium. It was the first part of the second golden rule. So the second part of the golden rule, it is the body excrete unionized. Here we said the body always excrete ionized form. They will excrete this part. So, but the body excrete ionized form from the opposite pH medium. Here it is vice versa, or opposite to the absorption process. The body absorbs the unionized form from the same pH medium, but excrete ionized forms of the drug from opposite pH medium. What does it mean? So if the drug is acidic drug, the kidney, if the drug is acidic, they will excrete from the basic pH medium. If the drug is basic, they will excrete through the acidic pH medium. So what does it mean? Why I am explaining to you? Because in the beginning of the lecture, I told you, or I promised to you, I will explain you this topic by master and simplified concept with the clinical correlation. So how it has connected with the clinics. So now I will explain you. If the patient comes with the drug poisoning, so for example, the patient has the patient's poisoning with the acidic drug. For example, which drug is acidic? You should know. For example, here aspirin or barbiturate. They are aspirin and barbiturate. They are acidic according to the nature. If the patient comes with this drugs poisoning, you should to know, in order to excrete the drugs through the kidney, you should to make the kidney alkalinized, to make the kidney basic. You should to make the pH of the kidney alkalinized. In order, how you can make the kidney alkalinized? By the giving of the drug sodium bicarbonate IV, in the IV. In this case, when the patient comes with these groups of the patient, you can use sodium bicarbonate in order to make the kidney alkalinized, in order to increase the excretions of these groups of the drug. So again, if the patient comes with the poisonings of the drug which are basic there, which the drugs it can be basic. For example, atropine. Morphine, or atenolol, propranolol, and etc. These are according to the nature. These groups of the drug, according to the nature, they are what? They are basic. So when the patient comes with these groups of the drug poisoning, in order to eliminate this poisoning, you should to make the kidney acidic. Why? Because the drugs which the patient poisoning, it was the basic. That's why in this case you can use the which groups of the drug? Ammonium chloride or ascorbic acid, vitamin C. These groups of the drug make the kidney acidic. So it was why I explained to you the pH of the drug effect in the absorption and excretion. It was the clinical correlations of the drug. Once again, I will tell you, if the patients come with the drug poisoning, the first aid, in order to help the patient from the death, your first work is what? The washings of the stomach by the gastric lavage. After that, you will find the antidotes of the Z drug which the patients poisoning with those drugs. After that, you should to make the kidney. If there is the drug acidic, you should to make the kidney basic by the using of the what? Sodium bicarbonate. For example, if this the patient's poisoning with the aspirin or barbiturate, you should to give to the patient sodium bicarbonate in order to improve the excretions of this drug. So if the patient's poisoning with what? With the atropine, with the morphine, with the atenolol, the dose of the drug which include to the basic, you should to make the kidney acidic in order to improve the excretions of the drugs through the kidney. In this case, you can use the vitamin C or hydrochloric acid intravenous in order to improve the excretions of the what? Excretions of this drug from the patient's body in order to eliminate the poisoning. It was how the pH of the drug affect in the absorption. Now let's go to explain about another part of the absorption, which is bioavailability. So what is the bioavailability? Is a fraction or the percentages of the percentage of administrated drugs that reach the circulatory system in active form. This is called bioavailability. Once again, I will explain you. Is the fractions or percentages of administrated drug that reach in circulatory system in active form. This is called bioavailability. So there is a different ratio of the bioavailability in the different types of the administration. For example, in the Peros types of the administration, it cannot be, it never can be 100%. It can be between 5% and below 100%. It is the bioavailability. It is the bioavailability of the Peros or oral types of the administration. Why it is so less? Later I will explain you which factors induce to the decreasing of the bioavailability in the oral types of the administration. Later, now I will explain you. So the second one, in the bioavailability in the intramuscular types, it can be between 75% and 100%. For intravenous, it can be 100%. Why? Because we directly inject the infusion or the drugs through the circulatory system. That's why it can be 100%. The subcutaneous, it is the same to the intramuscular. It can be 75 till 7. It can be from 75 till the 100. So for the rectal types of the administration, from the 70% till the 90, from the 30% till the 90% is the bioavailability. And the last one is transdermal. The transdermal, it can be from the 80% till the 100%. So it was the ratio or the percent and the bioavailabilities of the different types of the administration. So now here the question arises: why the oral types of the administration it cannot be handled? I will explain you. Because there are many factors which decrease the bioavailability of the drug. For example, this is the stomach. For example, this is this. So this is the drug. The drug, for example, its dose is 100 grams. So during oral types of the administration, this 100 grams never reach to the blood circulation. Maybe 50 from 100 grams. 50 grams of them they can reach to the blood circulation. So why the concentrations of this drug decrease till the blood circulation? There is several factors which induce to decrease this bioavailability. The first factor is what? Incomplete absorption. It was the first factor, incomplete absorption. There is any violation or any disorder in this process. That's why there can be decreased the bioavailability in the oral types of the administration. It was the first factor. So the second factor, it is the first pass metabolism. The first pass metabolism, which occurs in the enterocyte and primary in the liver. As I explained it to you here, so when the drug is in the stomach, before to go to the systemic circulation, they will go to the liver. In the liver, there is some enzyme, for example, cytochrome P450. It can be slightly changed in the chemical structures of the drug in the liver. Then from the liver, it goes to the hepatic vein, to the vena cava inferior. Then it goes to the systemic circulation. Due to this first pass metabolism, the concentrations of the drug will be decreased. That's why the bioavailabilities of the oral types of the administration is never 100%. It was the reasons for why bioavailability for Peros types of administration is less than 100. So here by this schedule or by this diagram I will explain you. For example, this is it in the bioavailability. It has the formula. So for example, this is the drug, and here we have the time. Here the concentrations of the which drug, for example, this is intravenous. Here we will write the it is the peak of the intravenous types of the administration. So I told you that bioavailability for the intravenous administration is always 100%. Why? Because there is that we inject directly the drugs through the veins. It directly goes to the blood circulation without passing to these three gastric cells, without going to the first pass metabolism. That's why the bioavailability, the fractions of the administration drugs that reach to the circulatory system is 100%. So now here the concentration of the intravenous, the drug, it can be 100%. So 100%. From here it goes during the times, its actions work during the times it will decrease. It means the drugs, when it undergoes to the metabolism and then excrete from the body, that's why its actions will be decreased. The concentrations of the intravenous, how it make the bioavailability. So now it was the intravenous. Now I will draw you here about the Peros, how in this diagram can be show its bioavailability. Here, for example, this is the oral types of the drug. When we take it, so when it absorbed, they cause what? They will cause the pharmacodynamic. They provide its actions. Then again what? Again they will decrease. It never can go to the 100%. It can be 50, or it can go to the 80%, but it never can go to the 100%. So this curve formed the oral types of the what? Bioavailability. So here the area under the curves, it is what? Area under the curves, it is called the bioavailability for oral types of the administration. That's why the formula, the fractions, the formula for the bioavailability is area under the curve of intravenous divided to the area under the curve of Peros multiply 100. So multiply to the 100. It is the formula how we calculate the bioavailability. For example, area under the curves of intravenous, it is 100%. 100%. So area under the curves area under the curves of the Peros, it can be what? For oral types, it can be 50. No, it is vice versa. Area under the curve. Once again, I will draw you. So here the formula for the bioavailability: area under the curve of Peros divided the area under the curve of what? Intravenous multiply 100. So here I will, by the area under the curve for Peros, it was how much? For the Peros, it was, for example, 50. So 50 multiply 100, 50 gram. So it was 50 gram. So for intravenous, it is always 100 gram. If this is 100 gram of the drug, they can be directly absorbed. So now 50 gram multiplied to the 100, result, it can be 50%. So it is the bioavailabilities of the oral types of the administration, how we calculated. It was all about the pharmacokinetics till the absorptions. Now about the distributions, metabolism and excretions, like this topic, I will explain you in detail in the next video. If you find this video, please respond to me by the putting of the like, sharing of this video to your friends. Then I will make you by the brilliant concept about the what? Distribution, metabolism and excretions stages of the pharmacokinetic.